What is heart? Heart is a pumping machine. It pumps the blood to all parts of the body. Heart have 4 chambers and 4 valves, the tricuspid and bicuspid between the upper and lower chamber, to prevent the blood to not go back to a chamber to mix with deoxygenated blood. And because your body needs oxygen, if the deoxygenated blood mix with oxygenated, so then the amount of oxygen will be decreased. Septum. Septum is a line in the middle of heart to divide the heart into two, right and left sides. The important thing about the heart, how it pumps the blood, how it increase or decrease the BP, the blood pressure, how it make the rhythm. Heart is covered by the different type of layers, the epicardium, myocardium and endocardium. Aorta is the biggest blood vessel of the body, which rises from the left ventricle. The arc of aorta and the descending aorta. So here is the SA node and AV node. So what is the important function of the SA and AV node? So the rhythm of heart are made by the pacemaker cells, SA node and AV node. The electrical impulse are generated there. These are the electrical conducting system of the heart. The BP controlled by the firing of the SA node. The autonomic nervous system can transmit a message quickly to the SA node. At n turn can increase the heart rate to twice normal within only 3 to 5 seconds. The electrical signals will pass to the SA node to the AV node, and then it will pass to the bundle of hairs to the all part of the heart. So these pacemaker cells make the rhythm and increase the blood pressure. So this is important in heart. And how the heart pumps the blood to the all part of the body. The medication which we use for the BP, that act on the receptor, beta 1 receptor, which is present on the pacemaker cell, and the turn it will increase or decrease the heartbeat. The medication, remember, the Indral, propranolol, citalol, carvedilol, that's the beta receptor blocker, which will cause the tachycardia or bradycardia. So that medication work on that receptor or pacemaker cells. And we also use the alpha blocker, the calcium channel blockers, to decrease the heart rate. The heart rate will be decreased, so the amount of blood will be decreased. So these drugs are working on the beta 1 receptor on the pacemaker cells. So here is the another pacemaker cell, the AV node. Remember, the SA node will pass the signal to the AV node, and the AV node will pass the signal to the bundle of hairs in the heart. So here is the arterioventricular node. So arterioventricular node is an electrical relay station between the artery, the upper part and the lower part, the ventricle. That is present at there. The normal heartbeat is 72 beats per minute. So here is the stroke volume. So what is the stroke volume? So the stroke volume, the volume of the blood pump go by each ventricle with each heartbeat. Now here is the cardiac output. So what is the cardiac output? The cardiac output, the amount of blood eject go by ventricle in 1 minute. the passing the heart blood per minute. There is a passing the heart blood per minute is 4.6 liter. The normal heart beat is 72 per minute. The fetal heart beat is 120 to 160. So there is a two type of circulation: the systematic circulation, which is rise from the left ventricle and take oxygenated blood to every part of the body, where in the tissue it will deoxygenate and go back to the right arteria by superior and inferior vena cava. And what is the another circulation? So there is a short circulation. Short circulation, it will start from the right ventricle by the pulmonary artery to take the deoxygenated blood. And the short circulation, the artery will take the blood, and that blood will be the deoxygenated. So the pulmonary artery will take the deoxygenated blood to the lungs, where it will oxygenated through pulmonary vein and came to the left arteria. The blood vessel is made by the three layers: the tunica intima, the inner layer; the tunica media, which cover the tunica intima. The outermost layer will be the tunica externa. A fibrous connective tissue gives support and protection to the blood vessel. It will be composed by the largely of fibrous connective tissue, and it will give the support and protection to the blood vessel. So these are three layers which is the blood vessel is covered. So there is a tricuspid and bicuspid wall, and also there is a pulmonary wall and aortic wall, which will not allow the blood to mix with the deoxygenated or go back to the chamber. I told you before there is a two type of circulation: the systematic and the short, also known as the pulmonary circulation, that will happen between the lung and heart. The systematic circulation will be start from the left ventricle and go to a tissue and then return to the right arteria. The pulmonary circulation will be start from the right ventricle and in to the left arteria. And there is the aortic wall, and there will be the pulmonary wall. So this is the heart, and there is the circulatory system. So I told you before how the blood vessel is formed. It is formed by the three layers. Remember, tunica intima, media, and externa. So this is the type of blood vessels: artery and arterioles. Anastomose. Anastomose is the artery which give a bypass or attached to another artery, and in artery. It will end somewhere, so that's why it's called in artery. And capillary, and also the sinusoid. Sinusoids are present in the liver. So now, when and we knew. Now I'm just trying to draw. This is the aorta which will rise from the left ventricle. So there is a ascending aorta and arc of aorta. This is the left subclavian artery which will supply the blood to your left side of the body. This is the common carotid artery. The common carotid artery will supply the blood to your head. And the another one is the right subclavian artery which will rise from the bronchocephalic artery. Your heart also needs the blood, so the coronary artery will supply the blood to your heart muscles. This is the ascending aorta and the descending aorta. The descending aorta will go to your chest and then it will go to your abdomen. So this is the abdomen, the biggest arteries. The pair and some are unpaired branches. So the first one is celiac artery, and that one is a superior mesenteric. The superior mesenteric artery and the inferior mesenteric artery. This is the unpaired branch of arteries. This is a fair branch of arteries which will supply to your adrenal gland, the suprarenal gland. This is a venal artery which will supply the blood to your kidney, and this is the gonadal artery which will supply the blood to the gonads. This is the iliac artery which will supply the blood to your legs. Now this is the structure, remember. These arteries are pair and unpair. And this is a sacral artery which will supply to the